Hi guys, in today's video I want to talk about an operation that I had done called a circumcision, and if you watch my channel regularly you will know that this is a video that I posted before. The first version of it that I posted just wasn't informative enough, so I did decide to refilm and repost, but then the second version that I posted got a lot of negativity and I did let that get to me. I had people telling me that my opinions were false and that I was giving out false information and that I was lying about stuff, so I really just wanted to refilm for a final time just to reiterate on the fact that all opinions I give in this video are my own and they're just based on my own experience, my own recovery and the way that this operation worked for me. I'm really happy with the end result and I feel like it's the best choice I've made for my own body. But that doesn't have to reflect your opinion. Our opinions can be different, and this doesn't have to dictate the way that you will heal. Everyone's anatomy is different, and depending on your age and medical conditions that you may have and the way your body's made, you are going to heal differently to me as you are going to heal differently to every other guy. And this isn't my usual content, so if you are a usual subscriber, please just click away and I'll be posting new stuff soon. But honestly, the reason that I want to do this video is not just because I am younger and I want to give the point of view from someone of a younger age, because when I had it done I was 17 and no one around my age was given advice about this topic. But I also want to do it just to kind of give advice from someone who is happy with the result, because people who are against this procedure are quite vocal in their opinions, whereas people who are happy with the result don't tend to talk about it much. And I feel like people who have a good result with this operation do need to talk about it more, just because the people who are vocal about the negative sides of it can put people off. And honestly, there are so many guys out there that are completely happy with the results of this operation, they just don't really talk about it much, and that is why it makes it seem like there are more people against it. And this video is going to be of an adult and sensitive topic, because it is talking about an operation on a part of the male genitalia. So if you are younger, I might advise not to watch this, but this is an operation that both boys and men have, so if you feel you are mature enough to watch this, then please carry on. But I am going to be talking about topics along a sexual theme, so obviously it's quite adult, and if you feel mature enough, please carry on watching. But I do think this is an operation that should be done at an age where you can give consent, just because I feel like you should be able to be mature enough to look over all the facts and complications and risks and make the right choice for your own body. Because even though there are guys in America and places that have it done as a baby that are completely happy with the choice their parents made for them, there are also guys now that are trying to restore their foreskin because they had that choice taken away from them, and I feel that should always be a choice that you can make as an adult. But if you didn't know, a circumcision is a removal of the foreskin, and there are many medical reasons why this is done. One of the main reasons is called phimosis, and that's where you have a tight foreskin. That's the reason why I had this operation done. There was also paraphimosis, which is where the foreskin gets stuck behind the head of the penis, and that can cut off blood flow. Can be very damaging and dangerous, so if that does happen to you, please go and see a doctor or healthcare specialist immediately. There is also inflammation of the penis that can be cured by a circumcision, and also cancer of the penis can be partially cured or fully cured by having a circumcision. So there are many medical reasons. Another reason that people have it done is just for cosmetic reasons. They feel like it looks better, and although I have that opinion, not every guy has to, and if you have a different opinion to me, that's fine. If you don't think it looks better, that's fine, but a lot of guys do get it done for cosmetic reasons. I would really advise that this is an operation that is done for medical reasons, just because it is such a risky procedure and it should really only be used to alleviate medical conditions. But if you have it done for cosmetic reasons, I can't tell you not to either. And that's the main thing that I want you to take away from this video. I'm not trying to push you into making a decision. I'm not telling you that you should have this done. I'm just saying that if you want to have this operation done, you shouldn't be scared not to, and you should be able to make your own mind up about it, because some people, especially people who are against this procedure, try and tell people what to do with their own body, and it should be your choice at the end of the day. But the complications of this operation, there are quite a few. The most common ones really are a lot of bleeding or infection, and about 1 in 10 to 1 in 50 men do experience bleeding or infection. Some guys get a lot of bleeding, some do not get a lot of bleeding. Usually if you do get bleeding, it won't be a lot and it will clear up by itself, but if you do have any worries about that, please go see your doctor. And again, with infection, please go see your doctor if that happens. Usually the key signs for infection are stuff like inflammation and redness, and they'll usually give you antibiotics to fix that. There's also a condition called meatal stenosis, which some guys get. About 10 to 20% of guys are said to get that condition. Most guys that I've heard give their experiences have said that they haven't got that condition, but if you do get that, it is basically the narrowing of the opening of the penis, and that can be treated by steroid creams or a small operation which usually heals quite quick. But not a lot of guys get that. Then on to more rarer conditions, there's one called chordy, where the penis bends over abnormally, and again that's one that not a lot of guys get. There's also a condition called buried penis, where the penis buries inside itself. Again, that is not a condition that a lot of guys get. And there is also skin bridges, which is where the foreskin tries to reattach to the head of the penis, and if that does happen, you will need a little procedure which will be quite quick and will heal quickly. But a lot of guys again don't get that, as long as you try and pull the skin back as soon as you can after the operation. They are the main complications, I would say. And then moving moving on to benefits, obviously the big benefit is that if you have a medical condition, it will usually get rid of that, or it will cure it, or it will alleviate it. But other kind of benefits of this operation include better hygiene. It is pretty easy to keep your foreskin clean if you do have one, but it is easier if you don't have one, because then obviously bacteria can't get caught behind it and you can just wash easier and you don't have as much mess. There is also the cosmetic reason as well, that sometimes it does look better. There are studies to say that it does help stop sexually infectious diseases, but honestly that's usually in the African strain of HIV that can help with. It's not usually our diseases that it helps, but obviously it does help a little bit, because then the bacteria from them diseases can't get trapped behind the foreskin. So they are really the main benefits. There probably are more, I'm just missing them out right now. And also there are lots of procedures that come under the name circumcision. Some are more invasive, some are less invasive, and obviously if they're more invasive there are more risks involved. Some of the less invasive ones include guided forceps, which is where they use forceps to move the foreskin behind the head of the penis, and then they make a little incision and it should alleviate the tension there. There is also one called a dorsal slit, where they make an incision from the top of the foreskin to behind the head of the penis and then around the head of the penis, and that should just be a less invasive one. But then there are more invasive procedures. There's one called a sleeve resection, which is where they remove a band of skin, and then any skin that is remaining that they suture out with dissolvable sutures. And there's also one called a preputioplasty, which is where they use two lateral incisions with a horizontal scar, and that should alleviate tension as well. So there are lots of procedures that you can have, and you really should talk to your doctor about all of them, because they will try and suggest the one that's best for you, and depending on whether you want to go down a more risky route or whether you want to have a smaller procedure. It all depends on how bad the medical condition that you have is. My foreskin was really tight, so in the end I decided to go for a full circumcision. I'm not actually really sure which procedure I had, and I probably should have checked into that more, but I really just handed over my trust into the people that were doing the operation, and honestly it turned out amazing. But all of these procedures will kind of have the same result really. And then there's also different styles that come into this operation as well. You can have tight and loose. Tight meaning that more skin has been taken away, so the skin is tighter down there, or loose means that less skin has been taken away, so it's looser down there. You can also have a high or low scar line. A high scar line is in the middle of the penis, and that basically means that more of the skin on the not on the foreskin, but the other part of your penis is removed, but then less of the foreskin is removed, so that gives you a scar nearer the middle of the penis. And then a low scar means that more of the foreskin has been removed, so it's nearer the tip of the penis. But honestly, no matter what style you have, or whether you have it high or low, it is going to be, it's going to work the same basically really. Obviously it's not going to work exactly the same as when you had a foreskin, because the foreskin does have lots of benefits. It does protect that area, and it does give a gliding motion in sex and stuff like that as well, so your penis is going to function differently after you have this operation. But what I mean is that even if you have a tight circumcision, it's not going to really affect the way that you have sex. The skin down there is made to be quite elastic, so even if you do have a tight circumcision, it should still work pretty much the same. Sometimes there are cases where too much skin is taken away, and if that does happen, you do need to go see a doctor. But again, that doesn't really happen a lot. And I really got diagnosed with a tight foreskin at a very young age, and I was told to start kind of massaging the skin down there in the bath when I was about 7 years old, I believe. So I did that for a few years, and of course I could have tried different treatments. I didn't go down the route of steroid creams, and maybe I should have, but honestly the foreskin was very tight and I couldn't see it coming back on its own at any point. I did try and force it at one point, and that is something that you shouldn't do. That can cause tears in the foreskin, and I know that my uncle had the same condition as me. He had a tight foreskin, and he never really had a circumcision, or he tried like other methods like stretching and stuff, but he never really had a circumcision. And then the first time that he had sex, his foreskin tore. So obviously it is a very beneficial procedure to have if you do have a tight foreskin, because if you don't and it is very tight, it can tear inside, and that can be extremely painful. So honestly, I'm just so glad that I had this procedure done. But I started getting this procedure sorted when I was about 16. I went to my doctor, I took my mum with me. I feel like if you take someone with you, it's a lot better. Even if you are a bit older and you feel a bit embarrassed, it's good to have a bit of support there. And usually at that first meeting, the doctor will want to do an examination, but she'll pull a curtain round, or he will pull a curtain round, so whoever's with you is not going to see anything. Then she'll usually, or he will usually refer you to a urologist who is a specialist in anything to do with that area of the body. And I mean, that appointment could be anywhere in the future, to be honest, depending on how efficient your hospital is. The same with the operation. You can't really choose to book your operation around a certain point or a certain holiday, because it will just be booked when the hospital has time and when they're not too booked up, so you can't really arrange it around commitments and stuff like that. But once you go see the urologist, they'll do another examination, and then they will usually advise what is best for your penis. My urologist just said to have a full circumcision. I'm not sure if I had a dorsal slit or something like that, but honestly it's turned out really well. And then of course I had the operation later on, and with any operation you will usually have a pre-op beforehand. That'll be about a week before, and in that they'll just weigh you, take your blood pressure and check that everything's okay. They'll also tell you what to prepare for the day. Usually you'll be asked to bring a pair of slippers and a dressing gown. You'll be asked to bring a book so you can kind of entertain yourself, because you will be waiting in a waiting room for quite a long time, and depending on your age you'll either be on an adult ward or a child ward. I don't think it matters so much if you are kind of on the older cusp of childhood, just because you won't see anyone on the ward anyway. You'll have curtains drawn next to you, so you ain't going to see anyone apart from the person in front of you. But honestly, I went on the adult ward and I had no problem with that at all. So my operation came around, and you're not allowed to eat or drink for about 6 hours before the operation. And when I got there, I arrived with my mum, but then you have to leave a relative behind, and I went down and got changed into the hospital gown, and I got my dressing gown on and got all cozied up and read my book for a while. I did have to wait about 5 hours, and it just depends on the day how many operations are booked in, and usually I think they will just book minor operations further down the line. Circumcision is considered a more minor operation, because although there are risks involved, if you don't have the operation done that day, it's not going to affect the way your body works a day later. Like, honestly, it's not as urgent as other procedures are. So I did have to wait 5 or 6 hours, but it was completely worth it. And in that time you will see a nurse who will take your blood pressure and get you to fill out some forms. You'll see a surgeon who will talk you through the procedure, and you will see an anaesthetist who will tell you about the drugs that they're going to give you to put you to sleep, and they'll ask you if you're allergic to anything. And then you'll later be taken down to a room where they'll lay you down on a table, and they'll give you the drip that will put you to sleep. They'll usually put a blood pressure cuff on, and it's really quick to fall asleep, really. If you've had an operation before, you'll know. Obviously if you haven't, it's very scary, but they'll try and distract you, and then before you know it, you're awake again, you're in the ward. And once I woke up, I did have a bit of bleeding. I did go to the toilet, and I ended up like bleeding on the floor. It wasn't very nice for me, but honestly, not a lot of guys experience bleeding. I just happen to be someone that does anyway. Even if I get a small shaving cut, I tend to bleed anyway, so I wasn't too concerned with that really, but it was quite a lot of blood. And then I did manage to go for a pee afterwards. This is why you shouldn't drink or eat beforehand. I still hadn't for about 6 hours, but my bladder still decided that I wanted to wee, and I did have quite a big wee after that. And then they'll take you down to discharge lounge. You'll meet whoever's taking you home, and then when you get home, I'd say just rest, like just get to bed completely, go to sleep. The anaesthetic should kind of last for about 2 days, so you shouldn't have any pain for the first 2 days, but then just give yourself painkillers when needed. And you probably will have to change the dressing after a few days. Mine fell off on the first day, and I ended up having to put my own gauze on. The people at the hospital did give me that, so maybe if you ask for it they will give it to you, but usually they just give it to you anyway. And when I was healing from this operation, I did put Vaseline on every day. It just keeps it lubricated down there, because obviously, especially if you've had a type 4 skin, the head of the penis, it's never going to have been in the air before, it's never going to have touched against anything, so it is going to be really sensitive. It's going to probably be as sensitive as if you put an ice cube to sensitive teeth. That's the kind of pain that you're going to feel, so you really do need to keep that lubricated. Also, if you keep it lubricated, it just helps with like any irritation down there, stuff like that. You probably will have a lot of swelling. I did have a lot of swelling, but it just depends person to person. My swelling was so bad that I did end up with a tear in the skin a few days later, but after that did heal up. That was quite painful, but again, not every girl is going to experience that. It just it happened with me, but it was a small price to pay, because now I'm fully healed, and honestly that healed within a few days, so I wasn't too worried about that. But obviously that did worsen the bleeding that I had, but after about a week or two the bleeding did go away. Usually you can go back to school or work after about a week, but I had to take 2 weeks off because of that bleeding. And once that is all healed up, as I said, I had quite bad swelling, and that swelling caused pulling on my balls, which did really hurt, and I had an ache there. But honestly, if that does happen to you, it should go away within a few days. Of course, with any of these things, if they don't go away after a little while, you should go see your doctor. But honestly, usually these things do clear up by themselves. And then after that, healing was pretty good, to be honest. I didn't have much pain. When I did, I just took codidromol, but honestly I didn't have much pain through my healing recovery. And then I started to notice I had a bit of extra scar tissue and a few tags, so I did end up having to have a second operation. I had my first one on the 13th of September 2016, and then I had my second one on the 29th of December 2016, so a few months apart. And that second operation was so quick and speedy, so I wasn't really that worried. But as I say, you may develop skin bridges if the foreskin tries to reattach to the head of the penis, so you really should try and massage that back as soon as you can after the operation, really. But once all of them like extra bit of skin have been taken away, and that took about 5 days to heal. It was a really quick healing procedure, and ever since then everything's been good, really. And moving on to stuff more of a sexual nature, Obviously, there is a complication that you can lose a lot of sensitivity in the penis, and that is a risk for every guy, really. Honestly, I have lost a lot of sensitivity, but it isn't in a bad way. I wouldn't feel sad about losing it, because the sensitivity that I had when I first had the operation done was awful. Every time that my penis touched a bit of fabric or anything, it would be honestly so painful. But now the sensitivity has dulled down, where day to day it doesn't, if it really touches anything, the sensitivity isn't awful. But if I was to like rub it or anything, it would be really sensitive. So the sensitivity is still there for sex and stuff like that, but it's not there every day. So that is what I mean when I say I've lost sensitivity. It's not in a bad way. I haven't lost it in sex, but I have lost it in everyday life, and I'm glad of that, because if I had to go for that sensitivity all the time, that would be really annoying. As I say, when you lose the foreskin, you do also lose the gliding motion, which helps you like kind of climax quicker. But honestly, I've never experienced that, so that's not something that I really miss out on, because where I had a tight foreskin, I never had the gliding motion. You may miss that if you did have that in the first place, if you're having this operation for a different reason. But honestly, I don't miss that, because I never experienced it. And I prefer if, like, when you masturbate it takes a bit longer, because you enjoy it a bit more. If it goes too quick, then it's just gone in a heartbeat, and it's gone in a few seconds, and then it's really boring. I've also had sex since the operation. I haven't fucked anyone, but I've like experienced oral down there and stuff, and honestly the sensitivity is really good, it's really great, and it's just, I prefer the look of it. I think it looks better, and that's just personal preference. But as I say, you don't have to agree with that. Anything I said in this video, you don't have to have the same opinion, and the people who were commenting on previous videos saying that my opinion was wrong, it's not bad to have a bad opinion about this operation, because obviously there's so many risks involved. What I'm saying is that you shouldn't try and push that opinion on anyone else, and that's not what I'm trying to do with this video. I just think you should make up your own mind. But I hope this video has been as informative as I can make it. I hope I haven't missed anything out, and I hope you kind of got the general gist that everything I said in this is information that I've kind of researched in the past. It's all what I found out in the past. All of it is true, and all that my opinions are true as well. They're all from the heart. But I hope you enjoyed this, and I hope it gave you a bit more insight into this operation and procedure if you're thinking of having it done, and I hope it helps you a little bit. But until my next video, please give this video a like if you enjoyed it, subscribe to see more videos, and I will see you in my next one. Bye!